So here in this next slide, we have here the fishbone diagram. What is the purpose of the fishbone diagram tool? It helps in brainstorming to identify possible causes of a problem and in sorting ideas into useful categories. So the fishbone diagram can also be a visual way to look at the cause and effect of a problem. So in this diagram, we see here the different categories mentioned that is associated with the chief problem. That is the catheter-associated urinary tract infection that is occurring among patients due to the lack of proper care. So here we have the different categories, starting off with people or the staff, the nurses. So here we can see that maybe there's a lack of proper sterile technique during catheter insertion and lack of monitoring the catheter by the nurses. The next category, which is materials, maybe the nurses are not using sterile gloves while inserting the catheter, no alcohol wipes were being used, and lack of proper size of the catheter. The next category is equipment. And then under equipment, we can see that maybe the catheter tubes were not properly draining and inconsistent supplies were seen on the procedural tray. And then for the methods, the number one thing that may cause this problem is lack of proper hand hygiene. That's very important to implement. And then not removing catheters once they are no longer needed.